Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi everyone, I'm Dr. Miret from Carolina Functional Neurology Center. I am one of the doctors in our Raleigh location, and welcome to our YouTube channel, What Did the Patient Say? Today it's just me, but I wanted to chat with everyone about childhood neurodevelopmental disorders. And so we have a lot of questions. We post a lot on our social media about these disorders that we treat and that we can help our kiddo patients continue to improve and work synergistically with other providers. So wanted to come on here and chat with you about what we do, some of the parts of our assessment, and some of the conditions that we treat. All right, so just to kind of start off, when we're talking about neurodevelopmental disorders, just a little bit of a definition. I mean, these are developmental disorders that are caused when the growth and the development of the brain is impaired. And some of the disorders that I'm talking about when we say this is examples are ADD, ADHD, OCD, as well as sensory processing disorders, both auditory, visual, dyslexia being another one. So kind of like a very large umbrella term for these types of conditions. And so we do see these in a lot of our pediatric population, but also this does also talk about adult populations as well. So we do treat both for these types of conditions. And so a big part of what we do at Carolina Functional Neurology Center, and this goes for every patient, not just the pediatric or just the adult, is we start everything with our exam. That is like the biggest tool we have in our toolbox to understand why is this happening. And so like I said before, these developmental disorders come on when the development of the brain is impaired. And so during our exam, especially when someone is coming in, if their chief complaint is these disorders, or, it may not be their chief complaint for the reason why they're seeing us, but, it is also a diagnosis that they have, this is something that we take note of. And a part of our exam, we evaluate how the nervous system has developed. And so one of the ways that we do that is we look at primitive areas of the brain, and especially an example of this is evaluating primitive reflexes. And so if you've never heard that term before, primitive reflexes are these reflexes that they're survival reflexes, and we have them when we're born up until about 1 to 2 years. And these are used, again, for survival mechanisms. And oftentimes with these cases, and I'm going to kind of go into the pediatric case right now, and then I'll talk a little bit about the adults, but for pediatric, oftentimes when we're examining our patients, we see that these reflexes have not been properly integrated. And so how I like to explain this to patients is those primitive reflexes are like the foundation to the brain. And so when we're talking about ADHD, OCD, auditory sensory processing, whatever it may be, those types of deficits or dysfunctions and conditions are caused by dysfunction in the higher cortical areas of the brain. So this is like your frontal lobe, your parietal lobe, your temporal lobe, like that, those areas where we're taking in, and this is also affecting like our attention, again, processing, motor planning, those are all higher cortical areas. And so how I explain it is these primitive reflexes are like the foundation of the brain. They're actually in lower areas of the brain where they get integrated and where they're housed. And so when they are not properly integrated, I explain it like the foundation of the house has some holes in it. And so we have to patch those holes in order for the house to be properly built on top. So that way, those areas of the brain that do help with like attention and motor planning, auditory, all those things can then properly develop as the child is going through their years through school and hitting those milestones appropriately. With adults in these primitive reflexes, oftentimes we will see these primitive reflexes in adults, especially suffering from metabolic injuries, as an example, concussion or TBI. Sometimes they can actually reappear. And so we always want to check for those, especially in those cases and other types of cases. And so where this is important, this is one aspect of our neurological exam. So previously to what I said, our exam is the most It's the most important tool that we have to understand, well, how is the brain functioning neurodevelopmental wise? How did it develop? Where is it currently at? And then, those areas of the brain that are causing those symptoms or conditions, how are those areas functioning now? So kind of the approach with treatment with that is we want to integrate those reflexes. We want to, and then as they're being integrated and they are remaining integrated, we want to then, challenge and stimulate those higher cortical areas to have proper outputs. And so I explain in the case with neurodevelopmental disorders, we work synergistically with a lot of other providers, such as like PT, ABA therapy, OT, speech therapy. And so we work synergistically with that. So that's a lot of questions I receive from, consultations or patients going, where do you fit in with this? And so I say that, OT and speech therapy, they're helping the child like sound out or grab things or whatever the task may be. We're working kind of in that background by giving the brain the tools that it needs to take on the other types of therapy that the child is doing. So like I always say, we work very synergistically with that. So that's kind of where we come in out of all the other therapies and modalities that these individuals tend to undergo. That's where we fit in with that, like another puzzle piece to that big picture. And in addition to that, we also evaluate any inflammatory or toxic contribution to the kiddo's brain development. And so what I mean by that is, do we have an individual who's had concussions in the past or hit their head or, just to say a few, are they consuming a lot of dyes? Are they consuming a lot of inflammatory foods? And obviously this is difficult to sometimes per each case to implement. And with parents and stuff, food can be always a challenge. And so helping evaluate, is there any additional things that are contributing to any sort of neuroinflammation that could be also impeding the brain's ability to develop? That is something that we also come in with. And so another question that we receive is, well, what does treatment look like? And so this is extremely variable amongst our populations, but I would say especially to kids. And so something, we obviously are integrating those reflexes, so that is exercises that we're doing in-house, as well as, we may give those to be done as homework. We like to teach, depending on how old the kid is, we like to teach the parents to help supervise or help do it with their kid. It just depends on the case, but we do that here. And then like I just said, we have to also address the higher cortical areas. So we have things like interactive metronome and Osmo and neurosensory integrators. We do other sorts of exercises to really help drive the development of those higher cortical areas. So even if, we're doing those reflex exercises and they're doing it at home, and then as that is getting handled, we're being able to challenge the child in different ways in the office. And so again, working synergistically with those other providers in order to actually help them, accomplishing like picking up a spoon and sitting down at mealtime and eating, or being able to handle louder noises or crowded rooms better. Those are things that we are able to help with. And these are just some of the few examples of why parents are coming and seeking out treatment at our clinics. So really, kind of in summary, the most important thing is the exam, to understand where the brain is currently at in its development, and understand, is there any holes in that foundation that we spoke about, address that, and as well help to stimulate the areas of the brain that were not, I wouldn't say unable to develop, but not developing to the fullest capacity based on the foundation having some holes in it. So again, we are working it foundationally with these individuals and kids, and then helping to stimulate neuroplasticity in those areas of higher cortical areas to help with those various conditions. We have a lot of tools in our toolbox, but everything does start with that new patient exam. So treatment for each kid does look very differently. And so that's why when you kind of start your process with us, once we understand what is going on, and how to address it. We can give those specifics, but we do have multiple tools in our toolbox at each of our clinics in order to accomplish that, or accomplish reintegrating those reflexes and stimulate brain growth. And again, in addition to that, we also address any metabolic concerns that may be driving neuroinflammation or any gut or immune dysregulation, other things that can also have a huge impact on brain development. So those are how we holistically treat this population. And again, we also treat adults with these types of concerns as well. But the main focus of this video was to talk about our pediatric population. And so I want to thank you so much for listening. If you liked and enjoyed this video, please let us know, comment, like, share on our social media. If you have any more questions about what we do, or more in depth about these primitive reflexes, we do have a lot of blog posts and information on our website and case studies. So you can definitely take a look at that at www.carolinafnc.com. So I want to thank you so much for listening, and I hope you guys have a great day.